This is IAQ Radio, Indoor Air Quality Radio, the voice of the indoor air quality industry, with your hosts, Radio Joe Hughes and the Z-Man, Cliff Zlotnick. And now, Radio Joe Hughes.
Good day and welcome to IAQ Radio Plus. It's episode 751, and this week we welcome Kenneth Mendez, the CEO and president of the Asthma and Allergy Foundation of America. We've got some very interesting topics to discuss about indoor environments and allergies and asthma, but before we get started, let's thank our sponsors. They're the reason we can continue doing the show. IAQ Radio Association sponsors are IICRC, the Institute for Inspection, Cleaning, and Restoration Certification at iicrc.org. The Restoration Industry Association, RIA, at restorationindustry.org. The Environmental Information Association, EIA, at eia-usa.org. IAQ Radio Industry sponsors are Particles Plus at particlesplus.com. BioPlanet at byoplanet.com. Tramex Meters at tramexmeters.com. EMSL Analytical Inc. at emsl.com.
And now you can win a cool prize. It's time for the IAQ Radio Trivia question. Be the first to correctly answer. Simply email your answer to czlotnick at cs.com. Or if listening live, just text your answer from your computer. And now, here's the Z-Man.
Hello, everyone. Congratulations go out to Dawn Weeks in Ottawa, Ontario, Canada, who was first to correctly identify 2014 as the year that the Indoor Air Quality Association began inducting individuals into their Hall of Fame. Here's today's IAQ Radio Trivia question. What medical tool invented in the 19th century drew physicians' attention away from the oral testimony of patients when diagnosing asthma, turning it towards the search for clinical signs? Back to you, Joe.
Okay, Ken Mendez became the CEO and president of the Asthma and Allergy Foundation of America, AAFA, in 2018. Since joining AAFA, he has led the organization in establishing a new multi-year strategic plan that emphasizes dramatically reducing the impact of asthma and allergies on the underserved and tripling the size of AAFA's online asthma community. The new strategic plan's vision is for AAFA to be recognized as the most trusted ally serving the asthma and allergy community. Welcome, Ken. Great to have you on the show.
Thanks for having me.
Our pleasure. Hey, let's start with a little background on the AAFA. If you could kind of give our audience an idea of who AAFA, where you're located, how many people you've got.
Well, we call ourselves AAFA, the Asthma and Allergy Foundation of America, so I'll make that easier on you. We're the oldest and largest patient organization representing the 100 million Americans with some form of allergic disease, whether that's asthma, allergies, food allergies, eczema. Those are the most commonly known ones, but all of those things are related in terms of an immune system response to some sort of allergy trigger. So the CDC does the count. Close to 100 million Americans has some form of allergic disease, so there's overlaps there. We're based in Arlington, Virginia, just outside of Washington, D.C. We've got a staff of about 26, 27 people, and then we're based in 7 states where we've got remote workers. We also have chapters in New England, Michigan, Alaska, and then we also work with a lot of regional community-based asthma groups.
And I'm just wondering, are allergies and asthmas, is that something that would be covered by Americans with Disabilities Act?
Yes, actually, that's a great question. That's really important to know that if you have asthma or allergies, those are considered a disability, and you need to have some accommodation for that. It's commonly known in the food allergy space, not commonly known, but that's one of the things that we've tried to make sure that people understand, because when your kid is diagnosed with a food allergy, for example, you need to know how to put a meal on the table, how to navigate the school system. But the same thing can be held for asthma or allergies, understanding to have medications. A 504 plan is typically what families would use in a school setting if your kid has some sort of disability, and in particular with asthma and allergies.
What is a 504 plan?
It's a federal plan under the American with Disabilities Act that basically allows for accommodation of someone with a disability.
I see.
And asthma and allergies are considered disability.
But you say this primarily has been food allergy related, but are you seeing more of a trend toward people being concerned about indoor environment, indoor air quality?
Yeah, I only say it because it's more commonly known there, but it's been around for a while. And I think what's more important, and as we raise awareness level, is that asthma and allergies are a disability. I mean, our audience and our community knows that. And that's why we're trying to do everything we can to improve indoor air quality. People spend 90% of their time indoors. So making sure that there's healthy air indoors is really important if you have asthma and allergies.
Okay, and another question, I don't know if you touched on this yet or not, because I missed a little bit of what you said earlier. What is the cost to our economy of asthma and allergies?
Yeah, well, if you look at asthma alone, it's $82 billion. That's an older figure. It needs to be updated. But $82 billion is the number that we generally use, which is cost to the healthcare system, cost in missed school days, cost of work. So all those things are factor into the costs. What a lot of people don't realize is over 10 people die each day from asthma. So it's really important to understand what your triggers are. So not only are there emergency room visits, which could be costly for asthma, it could actually really be fatal. So again, moving further upstream to try and improve your indoor air quality and reduce your triggers is really important for managing your asthma and allergies.
Now, I mentioned in the short bio we did on you, we have a longer one on our website, that you were looking at tripling the size of AAFA's online asthma community. What is the online asthma community?
Well, one of the things that we do is, as a nonprofit, we have a password protected area, which is moderated by our community support staff, that if you have a question or need to connect with others who have your condition. So this was long before Facebook and these public groups. That's what we have now. It started with food allergies, and then AAFA acquired kids with food allergies back in 2013. They had an online community. Then we migrated that platform to asthma, and that's where we wanted to really increase the size of our community there, because it's a safe space. It's moderated. We've got a feature where there's an Ask the Allergist. So if you have a question about allergies or asthma, we can get that answered for you within a few days or so. So it's a great place to go and get support from the community. We put the patient at the center of everything we do, and we support them with education, whether it's research, financial support in helping them navigate the insurance companies and understanding what's out there, looking at new treatments, and providing emotional support as well.
Now, all this support costs money. Oh, Cliff, let me go and let you get one in.
Yeah, no, I was wanted to jump in before, but Ken, what's the relationship, Annie, between asthma and anaphylaxis?
Well, let me describe it this way. Anaphylaxis is the scientific term and the medical term used if you're having an allergic reaction. So that could be to a bee sting, to some food allergies, or to penicillin. That's anaphylaxis. So your body reacts in a certain way, and there are very different degrees of anaphylaxis. But if you go into anaphylactic shock, or if the most severe element, the normal treatment for that is epinephrine, which that's the rescue medication if you're having anaphylaxis and anaphylactic attack. So that is anaphylaxis. For asthma, if you are struggling and you're having an asthma attack, the standard of care is to use a different kind of medication, inhaled medication called albuterol, which is normally an inhaled mist or through an inhaler, a metered dosed inhaler. You've seen them, you pump it. And that is what relieves your airways and opens up your airways when you're having an asthma attack. However, these are all under the umbrella of an immune system response to some sort of trigger. What you are asking, basically the difference is that there's a different treatment for each one if you're having a reaction.
Okay, now our audience is big. They're very interested in the indoor environment and indoor allergens. And Grayson, if you could pull up the section of the AAFA website on allergy control, indoor allergens. Ken, what I'm wondering, this has not always been a big focus, indoor environments. Maybe how long ago do you think AAFA started really focusing on this indoor environments and is there a big difference between what's on surfaces and what's in the air?
Yeah, well, what ends up on surfaces, I mean, your community probably knows this, and what we educate the public is what ends up on surfaces as dust, for example, starts in the air and then it settles on surfaces. But to answer your original question about how long have we been at this, as I said, we're the oldest and largest. We were founded I think it was our 70th anniversary a couple of years ago. So, in the trying to figure out how old I am, the 1950s or 60s. But I would say the program, our certification program, where we certify products that are asthma and allergy friendly, that has been around for about 20 years.
Okay. Okay. And now let's talk a little bit about your indoor allergens and improving indoor air quality segment of your website here. You've got here that the EPA recommends 3 ways is to control your contact with indoor airborne allergens, ventilate your indoor areas well, and use air cleaners to clean indoor air. I'm also curious that 8 out of 10 people in the U.S. are exposed to dust mites. How would you recommend someone who's concerned about dust mite allergen? How do they determine if they have dust mite allergen?
Yeah, that's a great question. And what we advise people all the time is to go see a specialist, to go see an allergist, and they can do testing on you to figure out what you're allergic to. Now, dust mites are everywhere, and basically they are somewhat invisible. They're microscopic, and they feed off of dead skin from humans. So that's why they'll be in your bedding, for example. And a lot of people are allergic to dust mites. So that could be a trigger for your allergens. So it's really important to go to an allergist, to a specialist, to figure out and work with your specialist to figure out what your allergens are. It could be dust mites. It could be tree pollen. It could be weeds. It could be grasses. So those are the things that you need to understand so you can better manage your allergens. I just put a quick plug in here. Next Tuesday, every year we release our Allergy Capitals report, where we look at the 100 largest cities and the ones that are most challenging to live in with seasonal allergies. And we use 3 things in the rankings there. One is access to specialists. The other is over-the-counter medication usage, and the other is pollen counts. So those are the 3 things that we use to put on the ranking. So if you're high on the ranking, if you're number 1, it means you're worse in all those categories. You've got high pollen counts in your city. You have poor access to specialists, so you can't get your allergies diagnosed and know how to control them better. And if there's high over-the-counter medication usage, it means you're having to use a lot of medications because you're miserable and you're trying to make your allergies go away. So that allergy capitals report we do every year, and that's coming out next week. But what we always tell people is stay indoors, avoid going outdoors during high pollen release times, which is generally in the morning or late morning. But you spend 90% of your time indoors. So we tell people when you're going from the outdoors indoors, leave your shoes at the door, leave your coat at the door. Don't bring those allergens further into your home. And then if you're out there walking your dog, for example, wash your dog off before you bring them into the home so it doesn't shake off all the pollen that can accumulate in its fur indoors. So it's really important to manage your indoor air quality. And that's the reason for why we have some of this advice on our website for our community.
Do you work with any groups? Like, let's say I've got allergies. I do. I'm actually going for the injections now, and it seems to be helping a little bit. But
But
I sometimes wonder, and now I can figure this out myself, but if I were a patient that had no idea about how to monitor or measure things in my indoor environment, and I went to the allergy doc, I found out what I'm allergic to. How do I then determine if that's in my home? Do you work with other groups that help, that have people that do that? Do you give them some kind of a home test kit?
yeah, we don't have any home test kits. Maybe your group does, and we don't. There's nothing like that we certify through our program because we know what the triggers are and where they can be found. And there's some things that people could do without having to, um, if those monitors exist, you can do some simple things like for example with dust mites, you could wash your sheets on a regular basis at about 130 degrees to make sure you kill the dust mites. We have certified asthma and allergy friendly dust mite covers, which creates a barrier so the dust mites can't get through your pillows and through your sheets. Obviously, indoor air quality, we've got air filters that whether you put them on your HVAC system or they're standalone air filters that help filter the particulate matter and clean the air. So those kinds of things are important. Having a HEPA vacuum cleaner, to vacuum your rug if you have them. Ideally, you wouldn't have rugs. And then simple things like don't sleep with your pet. Don't have your pet sleeping in your bed or in your bedroom. So there are a lot of things that you could do prophylactically, preventively, that we advise. And on what you've got on the screen in our Healthier Home checklist, you can mouse over each of the rooms in the larger graphic, and it gives some pointers of what to look for in your home where there could be triggers, whether it's in your bedroom, your kitchen, simple thing like in your bathroom. If you're taking a shower, it gets foggy in there because of the moist. Make sure you run the fan until all the condensation is off the mirror, or keep a window open because you want to reduce the moisture in your bathroom because that could create mold growth, and mold can be a trigger for allergens. So it's little things like that we try and coach people on through this graphic that you've got up on the screen where you can mouse over and look at the things that you can do to control your indoor air quality.
Grayson, go over that kitchen for just a moment. I want to look and see, is there anything on here that says that exhaust hood should exhaust to the outdoors rather than recirculating? Doesn't look like it.
There are a couple things on that. Whether it goes to the outdoors or indoors, so that's number 2 there. But
I see that, yeah.
we always say when you're cooking, turn on your fan. And I think if anything, that at least creates the circulation. And hopefully that fan is exhausting to the outside. I mean, I think you all are in the building field, and I think by code, shouldn't most of that stuff be exhausting to the outside?
Unfortunately, I don't know. Maybe in some of the newer code, but we've got millions of homes out there they're exhausted to the inside. I guess another question I have: does the AAFA have a position on gas stoves?
Yeah, well, I think that there's a practical aspect to it also. We're
Yes.
not telling people that you need to go get rid of. I've a gas stove, and I've got asthma, I've got allergies, I've got a gas stove. It's just not practical or affordable for me to be able to do that. However, if you have a choice, and the next time we replace our stove, we will probably go with an electric stove.
Gotcha. Gotcha. And then I noticed Keyshore put up a recent ASHRAE Journal article on kitchen ventilation. We'll include that in the
in the
blog.
blog.
Yeah. Cliff, do you have any follow-ups?
Not right now, Joe. Thanks.
All right. Let's go back to that main section of this part of the website, Grayson, and scroll down a little bit. There we go. Is it possible to control? So we talked a little bit about pets, wall-to-wall carpet. Other areas where allergens are more likely to be would be your soft furniture, your stuffed toys, your bedding. I notice you put damp areas, indoor plants, which I think is a very big source that people don't realize, mattresses, of course, and then pillows and bedding. Um, you mentioned when we were talking about mattresses, the covers, and then washing in what it was 130-degree
Yeah.
temperature. Okay, those are obviously good. And then you also mentioned a little bit about air cleaners. I'm wondering, um, what's the most recent research that you're aware of on the effectiveness of using these air cleaners for allergy relief?
Well, let me say this, that our certified program, certified asthma and allergy friendly program, uh, has a standard for indoor air cleaners. And I think the effectiveness of those cleaners is reducing the particulate matter and having the screen, the filter being able to do that. And I would think the other thing that's important, that some of these air cleaners or air filters, uh, some use ozone as a mechanism for cleaning, but ozone can be a trigger and an irritant if you have asthma. So we wouldn't certify something as asthma and allergy friendly if something had a mechanism like that. So what I would say is the effectiveness of the machines is their ability to reduce the particulate matter in your air space and in your air quantity. And we test for the effectiveness of that. And so that is what the program does. And you lay that side by side because you know what the size of a grain of pollen is. You know what that is from a particulate matter point of view. So you just lay that side by side with trying to reduce the number of allergens in your room. We don't make any FDA claims. There's no direct correlation. We can't do that. It's not a medical device. But what we can say is the effectiveness of our certified asthma and allergy friendly filters will say what they do, and that's reducing the particulate matter based on the certain size. And the other thing to remember is if you're a general consumer, making sure that you have the right kind of filter size because that really depends on the size of your room. So you want a certain amount of circulation, and you want to make sure that that room covers the size or the air filter covers the size of your room.
And do you have anything on the website that kind of helps, the layman with figuring out what size they need?
Yeah, I think there's something either on our certified asthma and allergy friendly site, but it's called the CADR
Yes.
rating. And that's what people, there's some general calculations on the capacity of a unit. You can look at a unit, see what its CADR rating is, and then look at that compared to what the size of your room is, and that gives you the guidance.
I've got a text from the audience says, what are the most basic things we should look into with air cleaners? And I think you've already mentioned a few, but I wonder if there's any other you'd like to mention. Like, I think one of the biggest issues with air cleaners is noise. In the certification program, do you test them for noise?
Yeah, I don't think our standard specifically has anything related to noise. I would have to go back and double check that. But what we really try and do is make sure that in terms of what it says it does in the particulate matter and the standard, accounts for, that it does what it says.
And Grayson, can you scroll down just a little bit? There is a section right here which just says, will air cleaning devices help? People can take a look at that. And then the steps you can take to control indoor allergens, control dust mites. Let's scroll down a little bit more, Grayson. Vacuum once or twice a week. That's an interesting recommendation. I remember I've done a lot of work with Children's Mercy out in Kansas City, and they have a healthy homes program, and they actually recommend that for every person and pet in your home. So let's say you've got, like at my home here, I have 2 people and 1 pet. That's how many times a week you should vacuum, which I thought was an interesting recommendation. But at least twice a week seems like better than a lot of people would do. Prevent pet dander. Let's scroll down a little more. Prevent pollen from getting inside by keeping windows and doors closed. Avoid mold spores. I wonder, do you have any more detail on dampness and indoor environments?
Yeah, I mean, I think we have it, the guidance there. For example, house plants, you can have mold inside your soil, the house plants. And, that's a big rub in my family because my wife loves to garden. She loves to have plants. And there's certain times of the year I'll come down and the windows will be closed. We'll have the air conditioning on, but I'll be sneezing. And I was convinced that there was mold in the soil of her plants, but I couldn't prove it other than just sneezing.
Well, you are correct. There's definitely mold in there. Let's scroll down a little more, Grayson. I want to make sure I covered everything on here. Control cockroaches. That's a big one. I think a lot of people don't think about.
Yes,
because,
absolutely. Yeah.
Especially in some of the underserved areas. I remember doing work down in Greenville, South Carolina. We had major problems with that. Let's scroll down just a little more. Okay. Now, what I'd like to do is go over to the certification program link and talk a little more. You've mentioned it a few times. One of the questions I have in the chat is, do you think vacuuming generates airborne particles? Which I'm sure we can all agree that does happen. But obviously, the first thing you would recommend is to use a HEPA vacuum.
Vacuum cleaner. That's correct.
And I wonder, do you have any certified HEPA vacuums on? Where would we find, like,
we used to have one in there. I think they dropped from the program recently. I'm not sure why, but it's important to have HEPA vacuum cleaners. And we're talking to some other companies that have HEPA cleaners in them, but that's really important. We recommend that.
Okay. And now let's talk about this certification program. I'm not familiar with how you certify a product. Let's say I'm a guy, I've got a new HEPA vacuum that I want to put out, and it's for homeowners. What would I do?
Yeah, so the way it works, again, this is a partnership that we have with a company called Allergy Standards, who's based actually in Dublin, Ireland, St. Patrick's Day on Monday.
Interesting.
But they come up with the standards. They do a literature review to see whether there's a standard out there. They'll create the standard, and then they will run that standard by AAFA's Medical Scientific Council. So we have a Medical Scientific Council, our MSC. The doctors will look at what the standard is and do a review of the standard. And then we will give our approval of it to say, yeah, that whatever the standard is and the lit review you did and the research you did around it makes sense. And then that establishes the standard. So then what happens is, if a company, you're mentioning, if you have a vacuum cleaner, you would then go to Allergy Standards and say, I'd like to have my vacuum tested for the standard. So they will do rigorous testing with an independent lab using the standard that we've developed to see whether your vacuum cleaner would clear or meet that standard. So they've got special chambers that they use. They grow dust mites, for example, that they have all sorts of allergens that they use, and they'll run in these testing chambers. And if it passes, then you have the right to say that you are certified asthma and allergy friendly, which is what you see on the website in front of you.
Interesting. Hey, we've got to stop and thank our sponsors. It's halftime. We'll be right back. We've got Ken Mendez, the president and CEO of the AAFA Allergy and Asthma Foundation of America. Our association sponsors are the Environmental Information Association. EIA's multidisciplinary membership collects, generates, and disseminates information concerning environmental and occupational health hazards in the built environment at EIA-USA.org. The IICRC, a nonprofit standards development and certifying body for the cleaning and restoration industry, IICRC.org. The Restoration Industry Association, the oldest and largest nonprofit professional trade association dedicated to providing leadership and promoting best practices through advocacy, standards, and professional qualifications for the restoration industry at restorationindustry.org. Industry sponsors are Particles Plus, feature-rich particle counters and air quality instrumentation. Count on us, particlesplus.com. BioPlanet at byoplanet.com, improving human, animal, and environmental health with electrostatic spray technology and advanced chemistries at byoplanet.com. Tramex Meters, innovation in moisture detection and humidity monitoring systems since 1974 at tramexmeters.com. EMSL Analytical Inc., providing high-quality, full-service laboratory services since 1981. EMSL.com. All right, we're back for the second half of our interview. We've got Ken Mendez, CEO and president of AAFA. Ken, I've got another question from the certification program. But before I do, let me just do a follow-up from the audience. Do you have any recommendations on where to place air cleaners in a room?
Yeah, well, I think there are a couple of things. One is near where so for example, if you're sleeping, you spend, 7 to 9 hours in your bedroom. Having your air cleaner in your bedroom would be really important because that's where you spend most of your time. So wherever you spend most of your time, and certainly close to where you'd be breathing. So I'd keep it fairly nearby. So that's kind of the guides we give. And if it's a standalone air filter.
Gotcha. But anything about where in the room, or?
I would just put it close to your bed and close to where you're sleeping, like
Okay.
where you're breathing, your head.
All right. Now let me ask you another question. We're just coming out of winter, and I wonder if you have any position on humidifiers.
Well, I don't know that we have anything that's certified, any certified humidifiers, but what we do say is keep the humidity in your indoor air environment around 50%. That's generally the target that you want to hit. And so I know that I have a humidifier at home, and it tells me what the humidity levels are internally. So I try and set it so it targets 50%.
Okay. Let me also go to the certification program again. What other indoor environment related products are AAFA certified?
What other indoor products are certified?
Yes.
Yeah. So for example, I think I mentioned pillows. We do have some window screens that are and then we've got some indoor sound baffles and then we actually have a new kind of flooring that's certified. We've got paints that are certified asthma and allergy friendly. I'm trying to think of what else we have. And then we've got obviously washing machines, and we've got laundry detergent that is certified. I mean, we've got a number of things. You'd have to go to the website and look.
Now, laundry detergents is a fascinating one to me. I don't know how familiar you are with this, but is that something that would how do you certify a laundry detergent? Is it Cliff, help me out with the name of the Subsolin, I believe was in a lot of these, and people were very allergic to that. Is that something that you?
Yeah, I think when we had the testing done on this, one of the interesting things is uh, the company actually started uh, uh, doing uniforms for athletes. Because if you think it's a fascinating story, because athletes need their uniforms every day, because they're washing them if you're a professional athlete. But then they decided to get certified. But one of the things that we advise is to wash your bedding at a very high temperature, like 130 degrees. And some of our certified asthma-friendly washing machines can reach that temperature, but the average washing machine doesn't.
Oh, okay.
So this detergent actually works in lower temperatures and helps remediate some of the things that would normally be washed out at higher temperatures, and that would be something like dust mites.
Yeah, going
Interesting.
back to, or just to add to, Joe had asked me to comment on, the subticillin is it's an
Enzyme.
enzyme, and in industrial laundries and so on and so forth, there were a lot of issues with it, particularly, those laundries that would deal with linens from restaurants that might utilize a lot of grease in preparation and frying and so on and so forth. So I think that, something tells me that they would not be in the products that you would be certifying, because I think they would be, the docs would be picking that up pretty quickly.
Now, one of the other products I was thinking about, I don't think you have any certified, but is anybody trying to get any of these low cost monitors, like monitoring for, particulate matter or VOCs? Are they trying to get any of those certified by your organization?
We always get inquiries, and then we leave it up to the company to go work with our partner allergy standards to decide whether or not it should be certified. I think we have a standard for an indoor air quality monitor. I'm not sure. I would need to check on that. I mean, one of the ways this partnership works is that company, Allergy Standards, does the testing, develops the standards, and knows the products. I mean, we're not experts in that, but we try and find a trusted partner and make sure there's sound science behind how that certification is developed. I'll give you an example. Right now, you go in a supermarket and something says it's organic. And what does that mean? There's no standard out there right now. And a lot of people out there say that it's an allergy-friendly product. You go in the store and see that, but what does that actually mean? And so when we started this program 20 years ago, we tried to put some scientific rigor around it in testing, which is why we partnered with Allergy Standards, and then allowed our name, AAFA's name, to be put alongside that in this partnership in order to make sure that people had some basis. So when our community was going out there and looking for products, that they at least knew that there was some scientific basis for the claim that it is asthma and allergy friendly.
Is Allergy Standards a not-for-profit, or is that a for-profit corp?
It's a for-profit company.
Okay. And it sounds to me like we need to get someone on from there sometime to talk a little bit about what they do. Sounds very interesting.
Yeah,
Maybe
definitely.
you could put us in touch with the right
Sure.
person there.
Yeah.
Okay, I've got a couple more follow-ups. Let's see. Are there any environmental friendly sprays to control the release of fine particles from surfaces, pillows, carpets, etc.?
We don't have any right now. We had one a while ago that P&G had, and I can't remember the name of it. It was Swiffer was the cloth. But there might have been a spray, and they eventually took that off the market. One of the challenges that we always have with sprays is the fragrance that might come with it, and that could be a trigger. So we're wrestling with that right now to see whether or not it's possible to have some sort of filters or spray to help with cleaning that isn't a trigger for someone's asthma and allergies, because you've got to be careful about the odors and the smell and the fragrances that come with that.
All right. Now, before we move on to another topic, I want to ask one more question on this certification program. And it comes from Josh Winton out here. He said, any thoughts on certifying a Corsi Rosenthal filter box, which we just talked about before the show? You and I talked a little bit about that. And at this point, they haven't done that. But I'm wondering, because they're not actually, Corsi and Rosenthal started a foundation, a not-for-profit foundation, and they now are.
I agree. I think it's a great idea. I was, that might have been a miss on our part, and we want to circle back and take a look at that. And in fact, I was at dinner last night with our partner who's here visiting from Dublin. We were talking about that, saying that, maybe we missed the boat on that, because it's not like a company. Normally in our certification program, what happens is companies will approach us to meet that standard because they want to sell something.
Sure.
And in our case, it comes in over the transom, but I think something like this can be very compelling, and we want to take a look at that.
It would seem that the challenges that you're going to have a do-it-yourselfer who's going to do this, some people are more meticulous and more careful in the assembly of this. Someone that's an engineer, someone that's an artist that's very, very careful, and then someone that's just generally sloppy. So it would seem to me that there would be some differences in the effectiveness of the device, because it's not consistent. It's not made on an assembly line where they check every piece or have quality control. So I'm sure you could probably do something, but I think you'd probably have to be somewhat careful in how you did it.
Yeah. Yeah, I think that's a really good point, and that's what we would need to account for in the standard, for example, is, here are the guidelines to make sure that you're assembling it the right way. When you've got a company coming in, we will do an audit afterwards. So we've actually removed some companies from the certification program because we were getting complaints from the public. So we did an audit, and then when those things weren't fixed, then we said we had to withdraw the certification. So we removed the company from the program. So that's where I think it's really important to have quality control over that. So you're right. With DIY, that was something that we would need to make sure that we accounted for in developing the standard.
Great point, Cliff. Thank you. I've got another topic here that I want to, let's see if we're ready for, we're not quite ready for the roundup, but wildfires. There's been a lot of attention now to wildfires, and I'm wondering what AAFA is doing, if anything, working with people who are, first of all, I'm sure wildfire smoke is considered asthma and allergy trigger, correct?
Yeah, absolutely. Yeah.
Okay. Are you doing any work related to wildfire?
Yeah, there are a couple things. One, in addition to having the cleaners, so that's people can get that certified asthma and allergy friendly cleaners. I'm going to answer that question in two different parts. One is, certainly we believe, and the science shows, that some of these wildfires are coming from climate change and global warming, climate change, let's say. And so we advocate for policies which will try and combat that. So, I mentioned earlier our Allergy Capitals report, where we've basically seen that the allergy seasons are getting longer and more intense because it's much warmer. So the growing season starts sooner because it's warmer. And that's when the first pollen releases start. And then it ends much later because the first frost, which generally kills weeds in the fall that pollinate, doesn't happen until much later. So that's the longer growing season. And then you have additional carbon dioxide from pollution. And so that supercharges the release of pollen from plants. So that's how you get the longer and more intense allergy season. So we are messaging around this all the time. And along with that climate change and those issues comes severe storms and severe weather events. And with these storms, you can have mold, moisture, and other things. So, and then wildfires, the same thing in terms of the smoke and the particulate matter from the smoke. So all those things have been a real concern for our community. So anything we could do on a federal level to reduce your carbon footprint is something that we try and advocate for. On a local basis, on a personal basis, there are things that you could do like reduce idling from your car. Don't idle your car because that throws off carbon dioxide. Now, I don't know that that answers your question specifically to wildfires, but it's a bigger picture view towards why are we having more of these climate events? And some of that comes because of our carbon footprint. So there's some things that you could do individually or at a federal level in order to reduce that footprint.
And all right, Grayson, let's go to the roundup. Okay, the roundup today is brought to us by Tramex Meters. By the way, also in Ireland, Ken. So maybe our Tramex Meters folks and the allergy folks can get together at some point. I got a couple final questions here. One is kind of a comment because we talked before the show. You haven't done much with Roxas, reducing outdoor contaminants in indoor spaces. Very interesting group. And I just feel like there's a lot of synergy between what you do and what they do. They're trying to keep pollen and pollution, et cetera, lower in indoor environments. Now, that kind of relates to a question we have here for wildfires. Should an air cleaner also have a carbon filter? Do you have any products certified that also have a carbon filter?
I would need to check on that, but to the extent that a carbon filter wouldn't a carbon filter reduce particulate matter? Isn't there a certain
It would reduce the volatile organic compounds that are also present after wildfires.
Yeah, I would need to check on that specifically, but I have a feeling that we probably do have some that have that, but I would need to check.
And is there, Cliff, God, you do your follow up, and while you're doing that, Grayson, if you could look on the website and see if there's a list of certified products that we could look at. Ken, is there a list on there somewhere?
Yeah, if you go to the certified website, you'll be able to take a look at what some of those products are. I think we've got graphics on the different areas, and you can click on them and see whether we have them or not.
Okay, while we're doing that, Cliff, you get your follow-up in.
Yeah, okay. Going back to this carbon filter and wildfire situation, we had an interview with Dr. Delphine Farmer with what's a Colorado State University.
Correct.
And she's done a lot of research on this, and I was really surprised that her research showed that contact cleaning with soap and water was way more effective than either opening windows or using air cleaners with carbon filters. So you have to check the blog for that show. I'm sure we spoke about it, but personally, I've recommended carbon a lot, and more recently, I've been disappointed actually by the performance of it. In all honesty, it just hasn't solved problems that I believe that it would, and it's one of those things that if a little bit is good, that a whole lot more should be better. And I've kind of found that, unfortunately, that hasn't always been the case.
Yeah.
So.
All right, I've got a comment. And actually, this kind of, Kishore, sometimes you read my mind here. This discussion makes me think that central HVAC is not effective in controlling IAQ. Any comments on that? So can we get better central HVAC systems? And that's one of the things that the Roxas program is working on that would help people with asthma and allergies.
Well, I know that 3M, for example, is one of the companies that is in our certification program. They've got a certified filter that I have seen and that we put in an HVAC system. So for a central system in the home. So I know we've got that, and we believe that that helps, and the filter does what it says it does. So I'm not sure about the comment that was dropped in the chat.
I got
Again,
you.
I'm not an expert in it, but I know it is certified and it says it does what it says it will.
We've done several shows with people from the American Academy of Asthma, Allergy, and Immunology. I'm just wondering, I'm assuming you guys work together or at least, run things by each other or
Yeah,
uh,
we have some of our medical scientific members are actually parts of those organizations. If you're an allergist, we do that. So yeah, we work very closely with them. And it's a fine line because our certified asthma and allergy friendly program, the doctors are always trying to connect and make the medical claims. And we're very careful because we say we don't make any medical claims about that. However, doctors will say you need to improve your indoor air quality. You need to reduce your particulate matter. You need to keep your windows closed. We're all on the same page in terms of what the interventions are for things. And we've just taken it a step further because at least we want to put some science behind products that we say are asthma and allergy friendly.
I noticed in the section on indoor environments, not carpeting's obviously kind of discouraged, and you mentioned that there was a flooring that had been approved. What type of flooring had been approved by the certification program?
It's done by Tarkett is the company that does it, and it's a you can't call it carpet. It's not carpet, but it's a soft flooring that kind of looks like carpet when you take it, but we can't call it that. And it is, and then they obviously have hard flooring, but we were pretty excited to see that kind of thing come up.
That's something we have to follow up on. We have had some representatives from Tarkett on the show. Would that be Cliff? Do you remember who that was? William Thornton, maybe?
Thornton, yeah, Bill Thornton. Yeah.
Bill Thornton.
I mean, he's a technical guy, so
Yeah.
he'll know
Yeah,
for sure.
they just got this product certified 2 years ago or a year and a half ago, and they're just launching it, and it's pretty interesting to see.
Now, do you certify? I mean, it seems like it'd be hard to certify like hardwood flooring, things of that. Or does any of the laminate flooring get certified?
Yeah, there's some of that in the program. Tarkett has some. We've got Knopf is in the program. They're very new. I mean, so there are folks who are in the program who have that kind of product. The interesting thing is once one starts, the competitor comes in, they look at it, and they want that kind of flooring too, and they want to live up to that standard. So I think that it's great for our community because they've got options. And the other thing is now people are more aware of what their triggers are and how to control for those kinds of things.
Now, earlier you mentioned that you're coming out with a new, I guess, report
Yeah.
on cities. I wonder if you can maybe give us maybe a little heads up on what we could expect to see in there. Anything that kind of stood out to you that's new?
Well, I can't, it's embargoed, so I can't tell you what the top capitals are. But we look at, as I mentioned, the 100 largest cities. And so you move up and down the rankings, and so it's all relative. So I would say there's some interesting things in this year's report where there was one city in particular, I won't tell you what it is, you'll just have to wait until next week, that jumped significantly in the rankings. And that was because of some weather events. And then there are other regions where, because as you mentioned, wildfires and other things that have gotten higher in the list. So I would just say take a look at it when it comes out next Tuesday or Wednesday. Go to allergycapitals.org, and that will be the hyperlink for that. Let me just add one other thing, because we do another ranking report that might be relevant here, and in particular in Pennsylvania. We do an asthma capitals report. So we look at the 100 largest cities and the ones that are most challenging to live in with asthma. And we use 3 things in that report. One is mortality, emergency room visits, and prevalence. So if you rank high in any one of those in one of the top 100 cities, it means that it's a bad place to live, a more challenging place to live if you have asthma. Allentown, Pennsylvania has been #1 for the last 2 years. We haven't released the new report, but the mayor from Allentown, Pennsylvania called us and said, how can we work with you to move us lower on the list? And some of that comes from stuff like understanding what your indoor air quality is like, removing the triggers. We've got a health equity program. We're working with community-based asthma programs around the country to try and remove indoor air triggers and make people more aware of how to manage their asthma. And those community-based programs demonstrate that you can reduce emergency room visits, improve health outcomes, improve presenteeism work, reduce absenteeism at school, absenteeism, children's missed school days. Asthma is a top reason for missed school days. So all those things are really important. So I mentioned that just because you're all in Pennsylvania, but the Asthma Capitals Report is something that we also focus on indoor air quality.
Yeah, Pittsburgh is always ranked pretty high on those lists as well because of some of the industry around the area. We've got some pretty high outdoor pollutant levels in the burg, unfortunately. Okay, Cliff, any final thoughts or questions?
Well, I just wanted to comment on Keyshore's question about his thought that a central HVAC system's being used to control IAQ. We've talked about it on the show a number of times. There was millions of dollars, maybe billions, was set aside to kind of improve schools, for instance. And what they ended up realizing was it would cost way too much to retrofit all these schools, and what they found what worked much better was putting air cleaners in the rooms close to the kids, and it could be done with a lot less electricity, and you don't have to move the air from one end of the building to the other. You can just grab it right there. So I'm not sure that a whole building system's ever going to be really effective. It would seem to me that.
Look, Cliff, can I just add a comment to
Sure,
that?
go ahead, please.
From what I've seen on something like that, and I know I'm not an expert in this, but I know that there's this ASHRAE 241 that's come out.
Yes.
Yeah.
And it's an effort to deal with indoor air quality in buildings, commercial buildings, I think.
Mm-hmm.
And some of this comes to human execution of this, actually doing something about it. So you can have an air monitor indoors, and you could have an air filter indoors, but you have to turn it on, and you have to make it work, or you have to switch out the air filters. There's some action that you needed. And I've heard about air filters that are donated to classrooms, for examples, in schools where they sit inside a closet because no one's plugged them in or turned them on. And that's a frustrating aspect. So I think for the ASHRAE standards and the HVAC standards, I would think you guys are the experts in this, but I'm hoping that was there because there was some sort of hope for that on a centralized basis in order to help make a building more healthy with the amount of circulation in the air or turnover or the ability to respond to a pandemic or not, and how you throttle your HVAC system. I mean, that's a layman's analysis of that. So you've got to start somewhere, but it really comes down to what's practical in a classroom or in a building and who's going to try and initiate or address some of whatever tools you have indoors.
Very interesting. And before we go, Ken, we always like to give our guest the last word. Is there anything we missed? Anything you'd like to add?
No, I think I'm preaching to the choir here. I really appreciate you having me on. And I think what I'll leave people with here is that 10 people die each day from asthma, and not a lot of folks know that. So it's really important to understand what your triggers are for asthma. See a specialist, see a doctor, so you know if you have allergic asthma, for example, so you can manage it. And visit our website, AAFA.org. And there's more information. You already showed some of it up there, but there's a lot more information so people could help manage their asthma and allergies.
All right. Thank you so much, Ken. We really appreciate having Ken Mendez, the CEO and president of the Asthma and Allergy Foundation of America. I want to thank the Z-Man, Cliff Zlotnick, Grayson, Gone Fish and Fisher at the controls. Most importantly, our sponsors and our loyal audience. We'll be back next week. We'll be back with Mr. Chris White from down in Louisiana. We've got a very interesting show with Chris. Cliff, what kind of conversation did you have with Cliff here recently?
Well,
with Chris.
Well, some of you may remember that those Doc Ekes commercials. The most interesting man in the world. Well, he did a lot of things. He did something called the most interesting engineer in the world. So he kind of did a takeoff on that, and very, very smart guy. He's a third generation PE. I think this might be the first time. We've had a lot of second generation people. He's actually a third generation. His grandfather was a PE as well, and they do a lot of work in schools. And Louisiana, as you know, Joe's been just hammered, with hurricanes and water damage and storms and so on. And so very, very smart guy. Maybe he showed me a picture of this LEED building, which I guess it was a green building because when you pulled back the wallpaper, it was definitely green. So, maybe he'll talk about that. We'll get some more information, but I'm really looking forward to it.
This is Win White's son?
This Win White's son, yes.
Win White, great show we did with Win. Check it out. All right, I want to thank everybody. We'll be back next Friday at noon with the next episode of IAQ Radio Plus.
For IAQ Radio, I'm Spike Reel saying thanks for listening.